Everybody, since we are two, can we have an interaction session? So, good evening. Hello, are you there? Hello.
They can unmute themselves, or they can use a chat box if you want to speak. Samuel and Martin, thank you.
Hello. Okay, let me start. This is about what I thought about first aid. We really recently were going through a bad situation where there were missiles coming in Qatar. So you know this. There can be anything like that, a first aid, earthquake or situation, or fire situation, or mass casualties or something like that. What my whole idea was that we need to be prepared to do something. This is Let me be very clear. This is going to give you good knowledge, which is going to be added to your knowledge and understanding to do things properly. Yes, you need to be doing more practicals to be considered a first aider, but knowledge is always very good and handy, because I know of a case. One of the family member, when I was training, he told me that his father was not well, and then when he called in India, when he was there in India, they called the ambulance. The ambulance said, "Do you know CPR?" He says, "I don't know." Then he says, "Okay, you can start. We will direct you." So if there is nobody around, they do take a chance. They tell the closest or the next to kin or somebody who is around to take the initiative, because nobody wants to give up without taking some chances. And then those chances, I saw that there were another case. So this person said he couldn't do anything for his father. So he was saying, "I wish I knew about this." And when he heard all about this, he said, "I would have saved my father also. Possibly I could have tried something, but I didn't know anything." There is another case where I came to know that another person did not know, and he did it, he broke the rib also. So that is why we say we need to be very careful when we do proper first aid with proper CPR. Other things are really very wonderful. It will help you with good knowledge and understanding. But when it is CPR, yes, you should have some basic understanding. In an emergency state, yes, you are the best person. You are like an angel that time. So if you know these things, you can really use it in the right way. So you can keep your mics on, and if you want any questions, you can ask me the questions. Okay, this is for enhancement of your knowledge, basic knowledge. Remember this thing. Uh, you may know about first aid, maybe, but maybe your spouse or your children, or no, they do not know. And remember, when it is a problem with you, a problem for you, you need others to help you. You need them to support you. So you cannot, just take it for granted that I know, so I will help others. What about helping yourself? How can you help yourself? The only other way to help yourself is to train people, your known people who are around you, to know and help you better. So this is the recorded session. You can show it to people, and when they see it, everybody, I feel it's not only the people who are working in France, but uh, we want everybody to know that there is a problem. So what we need to look at is that how we can find solutions to it. So you need to have solutions. You should have others to be trained to help you out also. And sometimes you need supporting hands. So I will show you all the things, what is the best, most suitable for you, because we can't train you to be a first aider in a real sense, because it's not a long session. It's a 1 hour session. So that again has a limitation. Practical is a limitation. But at the end, I want your feedback also. Did you learn? Can you share this video to your next to kin, friends, neighbors, family members, and how they can be helpful, even if when you are not at home. You know, nowadays you can guide somebody even across. So everybody knowing about it will help. I wish, some countries I heard they are training this mandatory in the school level, so that everybody is, it's mandatory to know. They are trained in their military, they have to compulsory go for military trainings, and they are trained, so because these are required during war times or calamities or bad situation, fire incidents, and all. So let us start with this. It is like us, the key word if you see is help. When we see this, this is my name is Rock Dikuna. I'm the chairperson, and these are my colleagues: Thai Faruqi, vice chair; Harun Rashid, the CPD committee coordinator member; Imam Hussain, the CPD committee member; and Alwar Rivera, the secretary. Why I said this photograph is that it helps the entire family. If you are knowing about first aid, you will know how it is helping the full family, the kids, the old members, family members, the neighbors, the friends, and everyone. And most important of all, it's you who will be helped if others know about it. Uh, Now, what is the important thing? It is to support or assist an injured or fractured or a person in emergency situation. Because we are not doctors. Remember this. We cannot try to become within 1 hour some doctor or something. So we need to look at it how we can manage it. So what I would say is, we look at it, it means you will be able to help at home, at work, and in public places. They are, categorized into three parts. So you can be of very good help at your within your family members, at your even around your with your neighbors, at your work site, and between the two, the work and the home, the public places while traveling, outing, picture, movies, parties, gatherings. I was able to help people even in parties. When somebody twisted or fell down, and so you can say and calm the people. So there are many other things like you preserve life, prevent the condition from worsening, or promote recovery. So key thing is you help yourself, your family, parents, children, and carers whom you take care, old members. You will give them confidence. It will give you confidence also that yes, we are in safe hands or something is happening. It's not that you will become a doctor and operate them, but you will do something and you will know what to do. Remember, today what you are learning is different from when you are in a panic situation. In a panic situation, there are times when people even forget what they know also. So it's best that you learn these things when you're in a cool mind, and it comes back as a flashback, and then you can do it in the right way. So I put a lot of pictures which I bought from the net. It just helps you to understand more better. That's all. And then it is like a repetition. If somebody guides you, you in the worst case situation, you might be of some help. So it gives the victim the comfort. Means also that the victim, like I remember, means suppose I'm, getting hurt, I'm getting some pain, and I go on crying till I see my mother or my father, and then I get that comfort. Now they have come, they are going to help, or they know what to do. Otherwise, the patient is not comfortable. He cries or he feels, thinking worse things to happen. So it saves a person's life in case certain situation. It even relieves pain and prevents infection if you know these things. For an organization level, it helps to meet legal requirements, better communication to health professionals. What happens is emergency means what? Only you will do it when there is an absolute help required, and that is will be also for a very short time. The moment a professional, health professional, means usually a nurse or paramedic or a doctor comes in, they take over. You only help them before they can come. You know what actually happens is, in these emergency situations, it is all about life and death. It's all about timing. We say time lost is very critical in an emergency or worse situation. So what you do is you will be trying to help them to reduce that time gap. Imagine, huh? I'm telling you, just imagine if you are going to call 999 or emergency number. Do you think they are next door or just next window and they come down back in 2 minutes? Do you know? And average it takes to 9 to 10 minutes or 20 minutes. It depends where it is located, what time it is, how jammed the traffic is, and what they are, how prepared they are, and for them to reach. And then, most important, when they reach, they have to reach to you at your location. But usually a first aider brings that person right to the gate or to the on the roadside, so that the moment the ambulance comes, they are very easily they just upload the person into the van, or they lift it and put that person, and they save that time of going up and bringing that person down. So you are going to help in those ways, how to bring the patient to save time and bring him at the reach of a doctor. It's like, meeting halfway. Like when we say there are two lovers, they want to meet. You don't say, I will stay here and let her come, or she stays there and say, yet you come. No, both will want to meet each other. They go halfway. Both might meet at a point which is more convenient for both. So this is exactly that. When you care for somebody, you want to save somebody's life, you will bring that person even closer to the reach of that person. You say, I won't wait for him to come on top, second floor, third floor, or inside the house, or I will bring it at the gate and keep it there. And then we can go. There are times I've seen a mother carrying the child, putting him in the car and not even waiting. The ambulance was called. But she put in the car, she saw, and she said, time is very essential, and she reached and she did a better job. So this is what is important. How do you manage? But don't do all those things. You have to see the situation. The child was okay. It had got some head injury, had fallen from the, from a ground floor level to a little basement level. So what I saw, that mother did a good thing. She saved time actually. She can carry, but if somebody is injured or something, fractured, then it's a different case. Don't do that. So you have to think of which is the best way. So I will tell you about what happens, especially not don't do anything with fracture. There are certain ways to do certain things. So you need to, then you can communicate those things. Even if a health professional comes to your side, that person wants some information, and like the person may not get, maybe more deterioration, or maybe due to unconsciousness or something, due to, like, it was even he can't start the treatment immediately. So if he has some information, like, this was the chemical, this is the poison, or this is the, fire, this is the tablet, or whatever. When you tell certain things, they know how to treat that person, because they have sufficient information. So you need to take those information and communicate to the health practitioner. Again, professional, when you treat, you are saving time. It's all about time management. Then you can manage the risk better. Risk is all about, again, time and how to make. It makes people more secure. I told you, if you're some, forget a friend or enemy, anything. Anybody with a white coat is seen, you might feel very happy. It gives you, that you are secure. Now the doctor came and something will happen. Otherwise, even if you are hurt, you are going to say, let me wait for some time. You won't give up till the doctor takes charge or something. So yes, if a first aider is there, the person sees that somebody is doing something, something will happen. Imagine if nobody is doing anything. So helps your peace of mind. Then it saves money also and improves the reputation of the organization. Any questions? One of the key things to notice, remember, if you have not contacted the emergency service, then they will not arrive. What does this mean? That uh, in most of the time, in a panic situation, people forget, yes, it's normal, human. You will focus on the person, that injured person, and every time as the time passes, you then tend to forget to call. Say that I thought over it, but no, no. And remember, if you have not contacted, they are not ready, they are not on their way. And they have to pass through this, I told you, the traffic, and then bring you down. It all is about saving time. So you need to, as earliest as possible, call for ambulances or emergency services. So in today's world, it is easier than, when there were no phones, you had to go or search for phone call somewhere and then die. Here you can, it's like mobiles are there with everybody nowadays. You can just keep it on speaker mode and start talking and start doing. Even no need to keep it on yourself or on your ear and hold it. So imagine you can even start seeing things, video recording or video call or something. So you but need to remember this thing, that you need to contact the emergency services under certain situations. So what are the things? As we go through, we come to know. The agenda for today, we will talk about the basics, introduction, roles and responsibilities, what is a doctor ABCD, ABC, and then how do we do CPR, how do we assess an incident, what is unresponsive casualty, respiratory system, choking, wounds and bleeding, burns, dealing with minor injuries or any other injuries. So we are going to cover these 10 parts. Let me start with first, we should look at the definition. Who is a first aider, or who is the first aider who can provide something? He's not okay, we don't think it should be a nurse or a doctor. It is any lay person with basic, remember, basic first aid knowledge. When we say knowledge, means he knows. The word know is there linked to the word knowledge. So he knows basic things only to fill in the gap between the health professional coming and he there waiting, so he can meet the halfway through. So he has the knowledge and the skills. Now you will come to know the knowledge in today's training. The skills to do it, that requires a little bit practice or a little bit of tricks and all, right? Practical about it. Skills. Uh, you may remember, this is an immediate treatment. Means emergency means immediate treatment received before the arrival of a qualified medical assistance. Anybody. It can be an emergency system, a nurse, or a doctor. So you are only fill in the gap period, to do it within the time period only. Then, what is you should consider first aid in the workplace, assessing your first aid needs. What you need to for the first aid. There are many things, to like first aider. When we say, it's like when you go to a doctor, you'll be told, like, that you may have to. What is your addiction? Means reactions. Do you have allergy? Or when it is paining, daytime, nighttime, or in the morning, you are getting headache. He will try to ask many questions, family background, your heredity issues. So why he is doing all that is to come to a conclusion that what is the best possible treatment to be given. So this is also what you should consider when you are saying that you need to keep some first aid requirement. What you should consider, like in a first aid box, or the number of people, first aiders you need to do. Those are the things, how you will decide what should be in your box, or what should be, how many first aiders you require, what type you require. That is a male and female type. In the Gulf countries, you need to be, you should have female first aiders to treat female first aid patients and all. So you should know all these things before you decide. So what you should consider is the nature of the work. Means what type of work is being done. Doing that work, what emergency situation will come, the workplace hazards and the risks which are there. Then the nature and size of the workforce, because there is a link to the number of people. It's not fixed. Again, it is this depending. You may have to say that every 10% there should be one first aider, or every 20 there should be, or 25 there should be one first aider. Then, but this is like for an average grown up in a workplace. But maybe in a school, it may be for small kids, you may have maybe for every 10 you might have, or 15 you might have one. What type of kids there? Are they, the handicap, or there are different types of students? So this has got very different considerations to be kept for the type of and composition and the people who are there, the workforce, the work pattern you have to consider. Like that is maybe whether it is day shift and morning shift and night shift or something like that. Then you need to have at all three times. What happens if it happens in the night of or emergency situation, or in the morning or in the afternoon? So then you may have to keep one person at all three shifts. But then only one may not suffice. What happens when that one person is not present, or is sick, or is absent, or is gone on leave? Then you must have a substitute for him at all the three. So we better to have two than everything. But two for maybe certain number or certain type of people. So again, you have to see history of accidents in that organization. This will decide about, give you a lot of answers. You may also need to look at what is the traveling time, or remote, or how are the people, traveling time for the ambulance to come to you. Or you may have to look at the remoteness of people working in different situations. Can they get first aid? Then you might have to train them also, everybody on the first aid, because people in working pairs, at least one should be a first aider. So we found out that in different nature of jobs, if you are lone worker, or you're working at a very far away distance, both should be trained, both can help one another like a buddy system. So you need to decide on that, the traveling, the remote, the lone workers, the distribution of your workforce. Here in this area there are 50, there are two, or here there are one, and like, so how their distribution is. Remoteness of the sites, medical services, whether the employees work on shared or multiple occupancy sites. Means you have to consider where there are multiple people, and then how much will be required there. First aid provision for non-employees or even members of the public. So these are all the things you might consider. These are some samples where less than 25, one small kit, one medium kit, or more than 100, one large kit. Now, these are just samples. Huh? One person really asked me one question. Once is like, in a rig, it is said one for every 10 persons. But each standards are different. That's why I said you need to, like one of the training time, I was asked, what is the right amount? I said, this, check your risk assessment, check the hazards, and check all the things that you considered in the previous slide. So that will decide. These are just an average or best practice, but you may have to go beyond this. If your situation, your organization, your risk, your hazards, your history tells you something different. So this is the way there is. Then you need to put one, the what medicines need to be put. Now again, this medicines will depend on what are the problems there. You get burn injury, then give burn medicine, burn related issues. Manage. If you're getting some, choking, or there are different fracture or whatever. So you look at it in the way that you need to treat in what is the possible things that happen. So usually you may have a first aid check sheet inside. You can put some dimensions of the bandage or anything. Expiry date is very important in a first aid kit. Then quantity is very important, so you can see whether it is sufficient. Then you can tick up every 1 month or every 3 months, quarterly. All this is risk assessment based. Okay. So the first aider must look at all the possible things, what needs to be put in the first aid. Some of the contents, I just put it out, is that you need to have some gloves. Anybody can tell me what you mean by gloves? What is the main purpose of a glove? Martin or Samuel?
Yes, sir. Come again. What is the main purpose of?
The gloves. Why do we need to
Gloves.
put gloves? Yeah.
You mean gloves?
Yeah.
Okay. Gloves is one. to protect the individual from any infection or cut. Yeah, that's why we wear gloves. Gloves as PPE, right? That's what you mean?
Yes, they are basically PPE. So good one,
Yeah.
good answer, Samuel. Good, thanks, and it shows that you are listening and you are interacting. So appreciate that. Gloves are
Okay.
basically a barrier, okay, a PPE, which is not allowing both the persons or protecting both the persons. If you are having suppose some cuts and all, and your blood is contaminated, it is some having some hepatitis or HIV or something, and that other person is wounded, your blood will mix with that person's blood, he will get infected. The word infected means the word iron in the word infected, it that virus enters into that person's body. It can be the other way around. That person's blood is infected, and you are having minute cuts and all, which you would generally sometimes won't know also between your nails or something, and you are touching, and it enters from there, and it's a problem for you. So what they are saying is you must have a barrier. Barrier means something to not allow yours to infect other patients, or the patient not to infect you. So in a worst case scenario, okay, this is just off the record. Suppose you don't have a glove and in your house or something or in a party, what you will do? Suppose you really don't have a glove. Are you still going to search for gloves and all? Is there any other option? Samuel?
Yeah, suppose you don't have a glove
Yeah.
and there is
In
a
a worst
chances.
case scenario, I'm
Hmm.
not taking this thing means, but in a worst case scenario, somebody in your house, a family member, what you will
Yes.
do?
Yeah, I'll assess the situation and I'll ensure that in the first place, I'm not having any cut on my hand or my palm. So in any way, when I respond to my family member in the first aid response, then after I'll make sure to wash my hand because it is an emergency situation which needs an action. So I
Good.
don't have to,
Washing, Samuel, washing means what is there outside will go out, right? We are talking about
yes,
what is inside, infection. The word iron, infection. If it has
infection.
gone inside, your washing will not help it.
Yeah, so when I'm responding to, let's say, for instance, a family member with stains of blood, and I have to assess myself first in case if I have any cut, I may get infected. Yeah.
Yeah.
So if yes, I don't have any cut, of course I can go on because I may not find gloves anywhere. I may not find gloves. Yes. Then
Okay.
for yeah,
Making
after
sense.
response,
Martin?
yeah.
Martin, any idea?
Hello,
Yeah,
I'm
Martin.
audible?
Yes, very clear.
Yes, sir. So can we use the clothes or for any plastic bags or something like that?
Fantastic, Martin. Don't, it is your family member.
Yeah.
So don't say there is no gloves, so I will keep quiet. Okay, so you can have some good quality plastics will be there in the house. I said it should be a barrier. Like a barrier should be like not allowing the liquid, blood is liquid, the blood to pass through. So you can use some plastic bag or something, good quality plastic bag. Making
After,
sense?
yeah, may I ask one question?
Yeah.
If the infected person is infected and we use any ordinary plastic bag, which is not sterilized, gloves, let's say, for instance, natural gloves, it comes in a pack. So
Yeah, I
for
agree with you.
with that
Because
one, it has no form of bacteria. But when we try to find any foreign material
mm,
around us, it may be infected with bacteria. Yeah.
I
So,
I
mm,
I agree with you, Samuel.
yeah,
I'm talking in a worst case scenario. You
worst
have
case
only two
scenario.
options. One is you like to do something, or one not to do something. Now,
Okay.
not doing something is actually not a very acceptable thing. You know,
That's
I saw a video on CPR. They're saying even if it went on to say that even if the bone is broken, rib bone, it is better to try to continue doing it and save the person. The bone
yeah.
will repair itself. But if you are not trying, you are already saying, Amen, you can die. I will not do anything. So, yes, sometimes bacteria is a different thing, virus is a different thing. And I'm not saying you pick up any plastic. You have an option. You can pick up any plastic, and there is a good plastic, then go for the better plastic. And if you have a plastic and you are not doing anything for your family member, I think it is not a right thing. You might repent for that you didn't try
That's
anything.
right.
Okay. So
Yeah.
this is just personal talking. Huh? I'm just
Yes,
trying to
yes,
imagine.
yes.
This is not like
I
there is a
understand.
difference between personal treatment. No, nowadays they are saying no breath mouth to mouth because of after
Mhm.
COVID. It started with COVID. But if it is a family member, you go ahead. They are saying. So it is again now up to you to decide. So there are different situations where people have done differently, and it comes out. You might be doing the right thing. Do you know in Piper Alpha, everybody were told to go to the the room where they could be going taking the boat and going out, going from the ship and all. But many people went on the air deck and all up, and they did not do anything. But there's some people who did the worst. They jumped into the water. There are sharks or cold water. It was very terrible thing. But believe me, they only survived. So I was just thinking, I'm just saying in a worst case scenario, they saved, because when everything was out, they are the only survivors who left the ship, did not wait, and took chances. So I'm saying that don't do it in a normal way. But if there is no gloves and a situation where you need to do, and if there is a good plastic, go ahead with it. Making sense? You can wash the plastic if it is with bacteria, if you have a doubt. But do something. This is, even when you call 999, they will not tell you to leave that person. That one person while training, he told me, the 999, they said, Are you the only person? Okay, we will guide you, but you do the CPR. And he was not trained, but they don't want to leave that person. They know anyway that person will be as there is bigger risk of not doing anything. So this is just, I hope I made myself clear. Okay.
Yeah, I understand. Thank you, sir.
Then there is gauge. What is the meaning of gauge? What does this gauge do? What is the purpose of the gauge? It's too many bandages put together, cut into some square piece. What could be the purpose for that? Come on, one by one. Matin?
Hello? Yes, sir.
Yeah, what I want is one person. So Samuel answer. Now, Matin, what do you feel about gauge? What is the purpose of that?
Gauge is basically used to absorb the bloods. If someone
Absorb
is
the blood.
wounded or some cut is there, the blood is coming.
Okay, good. Samuel, what do you feel?
Yeah, I agree with Mr. Miti. Yeah, it
Okay,
reduces the flow
I
of
will show
blood.
you something else. See, this is where you will get knowledge after this training. Okay, you will know the black, white, gray. Sometime in emergency, what to do. Barrier. I'm just giving you the gray areas, the different knowledge level. Yeah, the gauge does absorb the blood, but the main purpose of gauge is not to absorb, but to use it as a compression. With this gauge, you press the area where it is bleeding, and it is to stop the blood, not to absorb the blood. So when you press that area, suppose, just imagine, I'm giving you some vague examples, but it is easy for you to understand. Suppose one balloon is having a small hole and air is coming out from there. What would you do? There is a small prickly hole in that air balloon and the air is coming out. Wouldn't you want to stop that or pinch that area or press that area so that air will not go out? Mati, this
Yes.
question is to you.
We will block. Yes.
Yeah, so
We
this
we will
is,
block the hole.
yes, so this is what gauge does. You will be putting, don't put direct hand, use this gauge below your hand and between wherever the hole is or blood is coming out, you press it. Rest you leave it to nature. God has made you very beautiful and wonderful create design. What happens if the blood is not flowing for some time? It will cause a blood clot, sort of, jelly. The liquid blood becomes like a jelly blood. So it forms a coating and then blood automatically stops. Don't try to remove the gauge out because then you might take it, the coating out. Again, it might be. Just keep the gauge for there sometime. When you go to a doctor, you get an injection. After you get an injection, they give you a small swab of cotton and they say press it and keep it there, right?
Yes.
This is exactly that part, the gauge part. Clear?
Thank you, sir. Yes, clear.
Good. Are you learning something, Mati?
Yes, sir. Sure.
Good. Now, next question, Samuel. What is the bandage, triangular bandage for? What is the purpose of that?
The bandage hold the gauze together to the wound, and as well, it helps to reduce blood flow or stop blood flow.
Okay, good. It is like keeping it in the compressed position. Very good. What about triangular bandage now? Have you
Come
seen
again,
this?
sir?
This triangular bandage. This lady is having this triangular bandage.
You mean pin? I don't get that one.
Why is this one put?
The bandage?
This is a type of a bandage. It's called triangular bandage. Means it had got three corners.
With triangular bandage.
Yeah.
With that one, I don't have any idea, sir.
Okay, no problem.
All
Matin,
right.
question to you.
Yes, sir.
What is the purpose
It's
of a triangular bandage?
triangular bandage is the big one, right? I just know that one.
Yeah, it is looking big. Yes,
It's
good.
for the large wounds like that to use that
No,
one for
it
the head
doesn't mean
injury
that
or
this
something.
lady has got a wound from ear to ear. See, this
Okay.
bandage is holding to the neck and just not allowing this hand to move, to
Yes,
make it
yes,
immovable. Keep it in one position, in a relaxed position. Okay?
yes.
So why generally you don't want a hand to move? What could be the reason?
Maybe if there is a
Any idea?
fracture.
Very good. One of the thing is there is a fracture. So if there is a fracture, the more you move, the bones are sharp edges are sometimes cutting inside and creating more bigger wounds or bigger issues. So you to avoid that, you are just keeping it stable without moving it and then giving it to the doctor. See, we are not doctors. So it is to hand over to the doctor to manage it. Clear? Making sense?
Yes, sir.
Okay,
Yes,
now
sir.
back to Samuel. What is this? You can have these, stiffeners they are called, or sprints. You can put these sprints and all everywhere, and this will also not allow it to move. If nothing, suppose you don't have a sprint, you can use some wood or something. Okay, some plastic, some broom, anything which is going to keep it stiff and not allow it to move. So, like the triangle bandage, this is also called stiffener, which does not allow you to move further. Okay, then there is something called taking a shower in emergency. What is the purpose of this shower? Samuel, what is the purpose of
The
a shower?
purpose of the shower, I think, to reduce, to reduce contamination or for decontamination?
Good, very good. It is like it is reducing the contamination, or you can call it diluting first and then automatically reducing it. Okay. So
Yes,
when
sir.
you put water in any chemical, the chemical concentration part becomes less, the impact will be less. This is the first possible and important thing that you do. You even eye wash, if there is something gone in the eye, you need to put it with water to reduce the concentration. Then there are this hot and cold pack. This is cold and this is hot. Matin,
Yes, sir.
what is the purpose of a hot and cold pack?
The bags, right? The ice
Yeah,
bags and the
there's the
the
ice
the,
or
the hot
warm
the
water.
cold pack is used for the, like, swelling is there, pain is there, or for the what we can say, for burn injuries, minor burns, we can use it, that the cold packs.
uh, and hot.
Hot packs for the cramps.
Okay, good. What happens actually? When I put hot, what happens? When I put cold, what happens?
It will reduce the pain. Like if you put on the what we can
No,
say.
no. Before the reducing of the pain, what is immediately happening? The moment I put cold or moment I put hot, what immediately happens? Just
No
give it
idea,
a
sir.
thought. Okay, Samuel?
The blood circulation will is something like that.
Yeah, something like that. With what will happen? Blood circulation. You are right. Come on.
Mm,
Okay, suppose I just
can
put
be.
one plastic tube and there is blood inside. Okay, in that tube, outside the human body. I'm just saying. Imagine. Now, if I put eyes around it, what happens to that blood?
The blood slows down and it reduces swelling.
No, when blood
It
comes
reduces
in,
blood
the
flows.
blood will become cold, right?
Yeah.
If I put
Mm,
ice, it will become cold. When it becomes for more time, it actually becomes solidification. What is cold means? Extreme cold is called ice, right?
yes.
So the blood actually reduces its mobility. It doesn't move around. Okay. So if you don't want the blood to, one way is compression that I told you with the bandage, we can press it. Another way is to put ice and it will be becoming strong, solid, and it will stop becoming liquid, in other words, right?
Yes.
Let's take, you have seen milk when it is under the frame, what happens? It becomes small or it becomes big or expands.
Small.
You just take a cup of milk and put it in the stove and make it hot. What happens?
It will reduce the quantity. It will be thick.
It will reduce, but before reducing, what does it do? It will start swelling, right? Sometimes
Yes.
the milk comes out of the can, right?
Yes. Yes.
So what actually happens? It expands. Now between
Yes.
cold and hot, which expands and which contracts?
In hot, it will expand, and in the cold, it's contracts.
Good. So this is the meaning. That means that whenever there is like something that you need to loosen up, your nerves are there is some pain, sprain. It's you need to loosen up that. So then you put some hot thing and to loosen up. Okay, hot bath. But suppose there is a bleeding inside, you don't put hot, you put ice and it will become better. So you have to decide what you want. You want it to expand or it want to cool it down. Okay?
Okay.
Making sense or not?
Yes, sir.
Yes, sir.
We need to minimize infection. Yes, I told you we discussed it. We take personal hygiene. We ensure that some barrier device is there. This can be even plastic bag. Covering the open cuts, you minimize the contact with the blood or body fluids because of that some barrier. Changing gloves between casualties. Sometimes what happens is if you are managing two people, two patients, it's called cross contamination between one only two single person. It is between you and him, so one glove is enough. But this same glove may have the blood, and then you take it to another person, that person's blood will go to that other person's blood, so you need to change gloves also. Washing hands is our last option. Yes, you need to do that. It can be some person infected or direct and indirect also. Like if you touch some contaminated thing, you can get it also through contamination. Bird can have something called hepatitis or HIV, and that can also be a problem with it. You need to put some barrier somewhere, gloves. Even you got face mask or you have to look at the cross contamination, and you have to see that you protect yourself with the necessary PPE. You can have gloves, face shield, or pocket mask like this, a face shield. You need to have stretchers also. What is the purpose of a stretcher? What is the purpose of a stretcher? Samuel.
Okay. The stretcher is used to transport the victim from one place to another, and also to reduce movement of the victim.
Very good. Excellent. Now tell me, what is generally a big issue when there is a person who is little fat and there are four people carrying? This is very, very common. People think it is very easy, and you will see in the YouTube there are many cases where this problem comes. What happens when four people are carrying?
Okay, with any person that is big, a victim that is big, we classify the person as obesity. So in that case, when the person is injured somewhere and so many people are carrying him, they will end up pressing the infected area. And as well, if the person is heavy, it's difficult to carry. Those carrying the victim may even suffer lower back pain because of heavy weight.
Okay, that is manual handling, lower back pain. But tell
Yeah.
me, why does generally the patient fall down?
Why
Generally,
the patient fall down generally?
yeah, maybe the host with the stretcher, or the stretcher is okay, but he falls down. Why?
Because of the overweight and the size of the body, the stretcher may not be able to accommodate the big person,
Okay.
the obese
Okay,
person.
that is one way. Then suppose now the stretcher is normal, or it is smaller than bigger than the person. Then
Yeah. And lack of balance also maybe there.
good. What do you mean by balance?
Yeah, maybe one side of the person, the center of gravity may not be determined. So
Very good. Good
center of
point.
gravity
Center
may
of
shift
gravity.
to, yeah,
Now
other side,
you have to look at many angles, huh? Now you're
many
looking at
angles, yes.
first the individual, fat and all you mentioned. Now you're looking at the stretcher, center of gravity. Yes,
Yes.
good. Next one.
And, the distance of travel, the distance by which they are carrying the
No, I
person.
give you one little thinking. When there are
Mhm.
four people, do you think all the four people have one brain or they have got four brains?
Uh, no.
So they have got
The
four different brains.
coordination.
Very good, Matin. Matin. That
This is also
coordination,
important.
it becomes an issue because there are four people, their perceptions are different, their thinking is different, and their actions are different.
Yes,
So
sir.
what happens is two are running and two are slow, or two are trying to go right side, two are going on the left side, or one is going right, one is going left. It becomes a chaos. So what one of the four must say, I'm the leader, just follow my instruction. Then it is okay if one person thinks. Got it? For that coordination thing. Everybody else should follow. Clear?
Yes, sir.
This is one of the main reasons why people fall. You must say, take small steps, come on, let's go, let's move left, let's move right. Okay, keep it down, keep it down. So one person must be a common brain among all the four brains. Usually, you will see that there is no when to move a victim, if there is no immediate danger, or only when there is absolute necessary, or if there is no immediate danger, then you should only move when it is absolutely necessary. When you and the victim are in immediate danger, then you can move. From fire, lack of oxygen, traffic hazard, risk of drowning, risk of explosion, or exposure to bad weather, collapsing building, or electrical hazards. So you have to decide this thing about movement. Okay. Another way, suppose there is no stretcher. Like I told you about the handcuffs. Now, what about the stretcher? If there is no stretcher, what do you do?
Yeah, in worst case scenario, you carry the injured person by team, but ensuring that the
No,
injured
but if you
parties.
are alone, then see the photographs, what it says. You need to take a bed sheet or something
Yeah,
and then just take the person at the side. Don't move him too much. Just keep him one side, keep the bed sheet right in the corner and put him down. So you have this person inside automatically. Then you can pull him up like that. It is easier to pull the bed sheet. Clear?
yes, sir.
Then there is, sometimes you can make it like two people carrying like a seat. So, but both again must coordinate. Huh? Otherwise, they will drop this person. So this is like a seat carrier. But you must remember, no spinal injury is suspected only. If there is spinal, you can't carry this like that. You do more harm. You can even try in a worst case scenario, you can pull the legs or pull the shirt. Making sense? This is worst case scenario. Right?
Yes, sir.
Yes. Sir, can you show the picture because in the screen,
Yeah.
if you have.
Which, this one or the previous one?
No, sir, in my screen is paused, something showing like that.
Pardon?
I'm still on the first PPT. Who is
You
the
are the
first aid
first.
provider?
No, I'm having so many changes. What about Samuel?
I'm on. You mean the first page, the page?
Yeah, he's on the first page, he's saying. I'm showing the
Yeah.
food drag and all. Can you
No,
see the word food drag?
I'm at the lay person. Who is the first aid provider? Yeah, lay person.
Oh, let me put it up again. Can you
Okay.
see now?
No, still same.
Okay.
I would suggest if you stop sharing and then start again.
Yeah,
Rajiv.
I'm doing that way now. Okay, can you see now?
Yes, sir.
Yeah, I can see now food drug
Food
and
drag,
cloth
Okay.
drug.
close drag.
Yeah,
Yes.
So you saw this thing, this screen?
yeah, using
Yes,
a
sir.
bed
Yes.
sheet. Yeah,
Okay, the bed sheet I told you. Then you can drag with the bed sheet. This is where you can carry with two persons if two
two
people are there.
persons.
But this is only when you are not having any spinal injury. And then when you are alone, you can foot drag or bike dragging using the clothes. But if you suspect, then be careful of spinal injury. You need to be careful. You have to careful if the ground is rough or if the victim is like small, then the shirt might come out. So you need to. These are just options for you to see. Okay.
Yeah.
Yes.
Actually, there was a case with me. One person was on the sixth floor. Okay, He was very tall and very heavy to carry. When I was working in Saudi, he got electrocuted with the bus bar of the crane, and we were in the crane maintenance team. The ambulance came and the first aider said, the paramedic said that somebody must bring the person down. But he was so huge, it was difficult to carry him, to do anything. Only the option was, to take his arms around my neck, and I just walked down with gravity. His legs were getting hurt, by dangling. Lucky I didn't
Yes.
have to carry up, so it was going downward with gravity. When he got into injury, some people were saying, he will get hurt and all. I said, if he's kept here, he will die. I dragged him down, just like, his body was with me, but his maybe foot was getting hurt with the steps, metal steps which are there, the grating. But when I gave it to the ambulance, they saved him. They said, lucky you brought him very fast. And then he came back, he got a little hurt, but he said he thanked me for it. So these are, worst case scenario which I'm saying. You have to do something, think something, and try to save the person. Correct? Making sense?
Yes.
Yes, sir.
Now we will go to CPR. Okay, there is, for CPR, when you want to do a CPR, or if there is a situation where you need to do CPR or something, or you have to do, we divide into two parts, a primary survey and a secondary survey. So there are three surveys. One is the primary, one is the secondary. Before we do primary and secondary, some basic two steps needs to be done. You should conduct a scene survey and need for consent. These are the 2 points to be kept in mind. Then from the third point, it is do a primary survey, or then in the middle, you need to do a secondary survey. So this is the secondary survey, this is the primary survey, and these two are there. We will cover what is now we have to do. Okay, all these things. Now, when we say the first step, do a scene survey. When scene survey means you are assessing the scene. Survey or assessing the scene. When you do that, you must see what is the main purpose of the scene survey. Is it a little bit, dangerous? Is it going to be, when you are approaching the person, especially in many, many cases. This I told you why, because in a panic situation, very difficult to think best at your best. Only if you are mature, you are cool, you can think at your best. So what happens in a panic situation? People rush to help people. If it is especially their best friend or family member, they just rush. It is normal also. That's why, because it is normal, the overall success rate is very bad. More people have died. This is statistics. More people have died who are not the injured person or victims, but the ones who are going to help. Why? Because they did it very rashly. So for every one person dying, the victim, two other, helping person, the aiders or the helpers or the first aiders or even health and safety people, if they are not trained, believe me, I know about cases where health and safety people die. They just think they are ready to take risk, and they just go because their near dear friend is there or brother or some family member is there. They rush in and they are dead. So there, instead of one person dying, there are three persons dying. So the ratio of more people dying means two people dying for one victim. The one victim is dying, but another two. So it becomes three people dying. So what is the best practice to do is, don't rush. Keep your mind cool. You are supposed to take charge. Like imagine you are the pilot of a plane and you are panicking. The plane, you take you also down and all the passengers also down. So it's useless to panic. So what you must do is be cool and protect yourself and then protect others also. That's well said in the airplane. First you wear the oxygen mask and then the other. Because if you cannot do, you can't do anyway to the other person. You're already dead, you can't help the other people dead. So what you need to do is first look at the scene. Be calm, take charge of the the situation. Just look at what is around, why that person has become a patient. There must be some reason. analyze those reasons, or then you can first thing ensure you are safe. As a first aider, the bystanders who are there, because the victim is already a victim, but the bystanders are also there, and then the casualty. Means the aim is not to add on to the casualty. So first take care of yourself, then the bystanders, then the casualty. Then the very first chance you get, try to look at to gather information. Sometimes the person cannot give, the bystanders will tell you. You know, he was just standing, then he vomited or he fell down, or before falling down, he was asking for. It happened one case where he was saying, I want that from the bag, I want some that, and he fell down. So when I reached, they told me, there is he was saying like that. I said, check the bag. In the bag, we found, he was an asthma patient and he wanted to be given the treatment what that patient wanted. And then the told also, and the first aiders came and they knew what it is. So others also knew, the colleagues. So what happens is, it helps you a lot, even the first aiders or the ambulance to get. So gather information from the bystanders also. If the casualty can talk, you can hint him. The person was not able to talk. I said, back there is something, yeah. So, he couldn't talk. Some, he was, removing some face, like spitting from the mouth. So he couldn't talk also, and, vibrating and shaking, So we could do something for him. So look at keep cool, decide what can be done, and you can take this to the emergency team, and they will know exactly what to do. And that person was saved. It was one of a trainer in a classroom training. The students told me, and then all the other trainers also, though were there in other classes, they said, "Yes, yes, we know about this patient." Then we said, "Okay, this is that medicine. Okay, give you, okay, call ambulance," and then it all became very well ended. So imagine this thing, you can take charge, you can do. So now there are two parts. We say primary survey and secondary survey. After the first two steps of, take the scene survey, now you need to decide whether you want the first survey or secondary survey. After you take the next step, need for consent. We will, before coming to need for consent, we will look at it, what is primary and what is secondary. When we say primary survey means what you should do first thing first and second thing second. Mean first you do what is important. Suppose, I'm just asking in simple way. I don't want to just say everything. Suppose you are hungry, you need food also, and you are choking also, you need air also. Not choking, you can say you're not breathing properly. So what should be given to you first, the food or the air?
The air.
Air. So, you can actually stay without food for some more days. You may become thin and malnutrition and all that, but the first thing is air. One of the reasons why COVID has created a havoc in the world, it was, respiratory related issue. And if people did not get air or couldn't breathe, there were mass casualties, mass deaths. So imagine the air is very, very important, or rather we call it the respiratory system. So first primary service to look at your respiratory system. So look at whether the breathing is okay, because you need to treat the breathing person to breathe better first. And then you can look at all the secondary. Secondary will be maybe all the other things. Okay. So only two parts. First part, breath related, and then all the other that thing will follow. Now, first you need to take consent, as I said. Then you can go to the primary. What do you mean by consent? Anybody? Samuel?
You need to ask the victim whether it's okay to do this or do that, touch the body, you understand, or understand, like permission from the victim.
Very good. Very, very good. You need to take permission. Okay, especially in certain, a patient doesn't want it and he or she has already said, I don't want you to treat me. Technically speaking, you will do a wrong. Okay. Because that person might say, I told you not to do, and why you were treating me. Probably, maybe, because if, some people are not knowing the importance of, the law is made always for the good. There are good reasons for making any law, but the law is not for bad, also at the same time to cause harm to people. Laws are made for the society, for the rights of people, for the betterment of every society. So, uh, suppose you are, in a country where you are told, like, there is a female person who needs CPR, and that person is saying no. It is really challenging for you. When the person has literally said no. Now, maybe some countries they have no issue about this. Now, my question to you is that suppose the person, it was such a bad situation that the person couldn't say yes or no. The person was found fainted or couldn't reply. What do you mean? What you will do in that case?
Yeah, if the person couldn't reply, you still have to go on to respond, since it's a life-threatening situation.
Very good, Samuel. So it means that's why I said law is not made for making things worst. Okay, it is made for keeping society in consideration, and wherever possible, try to do the best. If not, worst case, as I told you, gloves, or I told you, stretcher is not there, then use the bed sheet or something like that. What is this saying that? Uh, if the person couldn't say anything, it means the consent is yes. It is called implied consent. Implied means it is understood that the person wants help but couldn't say, and you have the right. It is your right or duty to treat that person. Okay, if the person couldn't say, but but big thing. This is a little careful. You must be. You must not immediately jump for this situation. Okay? What you need to do is call 999. When you call 999, it means that it is a recorded conversation. These emergency numbers are on record. You can play it back, check it back. So it is not like I called you and it was not recorded mode, or I did not record your conversation. Nothing like that. All calls to 999 is a recorded conversation. So it gives you that extra support legally that when you call 999, they will ask you certain questions. If whenever they ask you questions that, is there somebody else around, a female, who can do CPR? And if it is yes, they will say, call that person. You let that person take charge. If for some reason there is nobody there, and they will say, okay, can you perform? They don't want that person to be without treating. So they will say, we are giving you permission. It is considered implied consent. You go ahead with this. Okay. So under their recorded conversation, under their permission, you can start the CPR. Making sense?
Yes.
Yes. Yes, sir.
This is just for the, how laws are made. It is not to make things worse. They are made for the society, maybe. So before commencing treatment of a casualty, the emergency first aider must ask and receive the casualty's consent to treatment. If the person is able to give, there are times when he may not. If the casualty is unable to give their consent due to their injuries or because they are unresponsive, you can assume their consent to treatment. Assume means implied consent. Is it clear?
Yes.
Yes, sir.
Okay. Then the first thing what you need to do is, after you got the implied consent, okay, or you got the consent, one of the two, or you got the permission from the 999 emergency services. Till they come, they say you can save the person's life. So what they will do, they will say, now what you should do is, I said first thing you must check whether that person is breathing. That's the first important thing. So responsiveness, breathing is there. For breathing, circulation is required. Okay. What happens is the air that we breathe, we put into our lungs, it is going with the blood. It takes nutrients and oxygen to all body parts. So circulation is the requirement to take it to all body parts. You might have to look at medical history. You might have to look where the person is injured, which part of the body is injured, sometimes very difficult. Like in the case of a pregnant lady, you can't do CPR on the little near the stump lower side. That it might affect the child also. So there are little you have to assess. There's no fix rule. One thing. So injury, where it is injury, you if the person is injured and you are trying to injure the person more bad, it is maybe you have to take a different decision. You can take help. You can call nowadays 999 is there available. You should monitor. You must look at calling 999 or emergency services. You must look at how you can rescue or bring the person to a safe area. You must look at putting the person in a recovery position. We come to that little later. And we have to look at if everything is okay, you have to look at whether the breathing and all is okay. Then you just look at secondary survey. Okay. Now let's go. What is secondary? I will tell you. Now suppose you call, first thing you have to call is 999. When you call 999, you must give some information. What are the informations? So, okay, Samuel, ask me, no, tell me, why would you give these things, these information? Why does a ambulance needs this? Number
And
first. Why they
the
need number?
number of injured person. Yeah, they need it so they will know how to go about the response and how effective,
How
uh,
many ambulances?
how many ambulances will attend and how effective the initial first aid that will respond to
Good.
those number of
Then
people, number of
nature of event.
nature of event is here talking about the typical risks or like the event that have happened. If it is fire, an explosion that has caused injured casualties.
Good. What was the event and how it has affected? Good. Next,
Yeah.
toxic. Why do you need to
Tox-
know whether it is toxic?
yeah, toxic environment here. They want to know, so they will know the required PPE to wear in
Good,
case
very good.
there is
If it is
hydrogen
poisonous, they
sulfide.
need to come with the SCABA.
That's
Confined
right.
space, why they need to know?
Yeah, confined space here, the equipment that they will use to respond, including hoist or any
Good.
confined
How
thing
to
and
rescue it out from
how
a,
to rescue.
if the
Yeah,
patient is somewhere inside, how to bring him outside? So
that's
they need to
right.
carry something with them.
Yes,
Okay,
sir.
confined spaces. And then why do you need to know the need of respiratory, like toxic environment, and prioritizing care? Prioritizing care means if it is more than one person, then whom you will treat first. Come on, if there are many people injured in different, whom you will treat first? Just connect the dots. We just told before. Who will be more earlier to be treated?
The victims you see with severe damages or have the potential to
No, I will give you two incidents. Okay. Somebody is having fracture and having deep pain. Another person is having no breathing and lying quiet and calm. The one fracture making big noise also, having deep pain also. Now, whom you will treat first?
the one with no breathing, of course, could die. The fractured
Good.
one will
Yeah.
sustain the pain for some time.
Very
And
good thought, Samuel. It means that when the person is not shouting, not doing anything, that doesn't mean I'm going to treat him afterwards. The one who is shouting, yelling, paining is more. Yeah, he's having no pain. The other fellow has no pain. But if you don't treat the person with breathing issue, within 6 minutes or some 10 minutes or maybe 4 minutes, the person is dead. Then you don't need to treat him also. But this fellow with pain, he will be there pain for the whole day also. you can reach to him afterwards. So that is where we take prioritization. Good. Then we will look at the breathing part. There are like, two types of key issues where we need to look at the breathing part. Okay. We will consider first the people who are unconscious, who cannot talk. So there is unconscious who is not breathing and unconscious who is breathing. Now, the very first fact priority is unconscious. So in that unconscious, within the unconscious, there are two parts, the non-breathing and the breathing. You have to first consider the non-breathing guy. He is unconscious also and not breathing also. CPR, straight away. Not breathing, CPR. Unconscious but breathing, don't give CPR. Why? Why should a unconscious and is breathing? Why you don't need to give CPR? Samuel?
Yes, sir. Come again. I
Why
was
you
trying to
don't need
fix
to?
my headset. Yeah.
Because the person is already breathing. So, when he's not breathing, you want to give CPR for breathing to make his breathing start again. Okay. But if he's already breathing, you want to make him breathe a little more? No, his system is working. When you're saying not breathing, means he has suddenly now become unconscious and he is just now not stop breathing. But within 4 minutes, we don't start that breathing by external help, then that person is no more able to breathe. Gone. Brain cells start dying. So what we do is, like suppose, now your car suddenly stops. Okay? Now what you will do is, maybe everything is okay, petrol is there, light is working, but still that, no, the engine is not starting. So what do you do to that car? There is petrol, there is all power, light is shown there, there is some light coming in, but it is not starting. What you will do? By itself, the car is not starting. Have you seen this case? Matin, what do you do?
I will call the mechanic.
My goodness, that is good. But immediately, what do you do?
I will park the car if it's in the
No,
center of
the
the road.
first thing, remember
Then I
what I
will.
said.
Yes.
Everything is okay, light is there, petrol is there. If there is no petrol, I can't do anything. Okay. There is a
Yes.
petrol, there is a light, there is some, but the starter is not starting. So
Yes.
what you can do?
I
You
will
just
try.
need to start. So how you do?
Yeah. I will
By
try to
itself,
start again.
how? Okay, I tried with the key, start again. It's not happening. Then what do you do? You are sitting in the car and trying. It is not happening. Then what to do? You will ask for help for some other people to
Yes.
push the car. Have you seen this situation?
Yes. Yes. Yes.
Then the car starts, right?
Yes.
This is called starting by some external support. Some external people are pushing it, and that starts the battery. Got it?
Yes. Yes.
Understood this whole what I'm saying, Samuel?
Yes. Yes.
Now, this is
Yes,
the
sir.
same
Yes,
case
sir. I
with the human
understand.
being. A human body is there, normal, everything is just okay. For some reason, the heart just stopped, not getting that electrical charge. Then, instead of like pushing the car, here you are starting the CPR. CPR will just suddenly start the car, if it is possible. Okay? Otherwise, not possible. It is just an attempt you're making. But this attempt can save a person's life. Making sense?
Yes.
I'm just trying to make it as
Yes,
simple
sir.
with an example. Okay, so you will be trying to do a CPR to start the functioning of a parts, the lungs and the heart pumping system. We call it pumping system. to start pumping and circulating the blood and giving oxygen to all parts of the body, and the person is awake again, which was, paused. I use the word paused. Breathing is paused. So you are restarting it, but it should be immediate. Yeah, after a little while, no use. We come to know the later why it's little later. Okay, how much it is. Then, so this simple explanation about what is CPR, you understood what I meant by CPR?
Yes.
Okay. Then the third option is consciousness, right? So unconscious, the third is conscious. In conscious, it is go for the secondary survey. Means the breathing is there, the person is normal, but he is injured or he is having some illness. You go for secondary survey. Okay. What can be the reasons for unconscious? Many. Head injury, poison, hypothermia, heat stroke, epilepsy, heart attack, stroke, and shock. These all could be the first two. Third one is just simple, go for the third. Priority, I told you about priority. First is whom? Samuel, who was
Someone
the
is not
first person
breathing.
I told? Matin, go tell me.
Someone
Yeah.
is not breathing.
Breathing. Next one,
Bleeding.
the one who is a lot of blood flow is going out, right?
Yes.
Then
Yes.
one is with the bones and the bone and other conditions. And in certain circumstances, priorities also can be changed. There is no fixed rule. But this is the best practice. If breathing is not handled very fast, gone. So give it first priority. Next, blood flow. Why do you need to give this more than this? This there is more pain. This there is less pain. In this also there is less pain. But this one has the most pain, bone and burns. But why blood flow has to be given second priority? What happens if the blood comes out? It's like the transport mechanism inside. It takes the blood takes it to all the body parts from up to the brain, to the toes. Now, if the blood is less, it will not go to the brain, the person is gone. Clear with this?
Yes, sir.
So we see this is called doctors. The S is not there now, no shout, no defibrillator. Doctors ABCD. Okay. We see doctor is seen the survey, means seen, we discussed. Danger is there, check for the danger. Then the R for the D and R. The R, what we will check, whether there is a response. Okay. Now, how do you check for the response? You will check by these methods. AVPU. What is the meaning of A? Alert. What is V? Voice. What is P? Pain. And what is U? Is unresponsive. Now you have to look at the responsiveness. You will check, one way to check is there any movement? If the person is hand, shoulder, and shake, whether he's conscious, he's talking, asks his name, fine. This is about, you can say he's conscious, he's having movements. Or you will be talking to him, verbal speech. You will talk, talk doesn't mean only by mouth, huh? They can even talk through eyes. He might just open the eyes a little bit, close it, or shake the eyes, or show big eyes, or something. It means he's responding. Not necessarily by mouth, but by eyes. That's a communication mechanism. He might, be making some noise, or moving a limb. This means he's conscious. Sometimes you have to check for the pain. You pinch the person's ear. This is a very sensitive area, pinching of the ear. When you pinch it, the person will shake or press his fingernail. If he's getting a little pain, he will try to pull his nail. That means the person is conscious. If you don't get all this 1, 2, and 3 by alert or by voice or by pain, then you must consider the person as unconscious. Okay? Nowadays, there's no need for shout. You can use your mobile. You can use, you can get first aid information. You can talk to your mobile and get all video calling and all like that. I told you before, CPR time, within 4 minutes, brain damage is unlikely. You have to treat a person within 4 minutes. After 4, your brain damage is possible. 4 to 6. It's better to manage it between this two. 6 to 10, brain damage probably have happened. Above 10, probably brain is dead also. So you need to do everything within target within 4 minutes. It's challenging, huh? Then we start with A. So D is for danger. Okay, R is for response. So we have to look at any danger around and then see the response. If he's responding, conscious, breathing, go for secondary survey. Now, the problem is when he's not responding and is not breathing, then the only way to breathe is to lift his chin up. You know why we lift the chin up? Can you see these photos? Which side the chin is lifted? First or the second? And why?
The first one,
First one.
because
Why?
yes,
This
because the
gap is created.
airflow, yes.
Okay, here see this is a block, right? So what you are doing, A is the airway. I told you this is the most important part. Within 4 minutes, no use after that. Very fast you have to do. So you pull the thing, keep it open and allow the breathing to happen. If he's breathing, good. Be careful while lifting. If a person is having some skull injury or something, whatever you know, take care of that. So you have to do everything with proper care. We have to start the CPR. If he's not breathing, within 4 minutes you have to start. Any delay reduces the chance of surviving, the chances of surviving. Like that is happening. So we should do within 4 to 6 minutes. The B part now we saw the airway we opened. And he started breathing very good. First thing, open the airway, check if he's breathing. Now he's still not breathing. Okay, then you will confirm whether he's not breathing. You open the airway, now you are confirming. How you will confirm? By these three words: look, listen, and feel. When we say look, listen, and feel, you have to look at, you have seen this girl, she is keeping the ear close to the nose. So the ear is this, the listening part. Okay? Feel part is the chin. You know, the chin they feel the air coming out, the breathing. So she can hear and she can feel. And she's looking also. She's looking at the stomach. So if you look at the stomach and it is rising up and down, it means that the person is breathing. So you kept the airway open and the person is breathing, means the car is started already or starting. Now no need to push. But if it is, you try to put the key and it is not starting, but everything else is okay, you can try it by external, by pushing the car. Now this is where you might have to give CPR. If it is now notice that the person is not breathing, then you will be looking at the simple thing like a CPR. This you should do within 10 seconds. This or within seconds we are talking. Because within 4 minutes we must do everything. So here we are talking about within 10 seconds, we have to look at it. Now we are looking for the CPR, the C or the CPR or the circulation also we call it. Circulation means simple. You want the air to go to all the body parts, especially the brain. Circulation of food, circulation of blood to go to the brain, carrying the oxygen with it, and the brain gets the oxygen and the nutrients and is not dead, brain dead. So if you're not brain dead, you are alive. So this is the first thing to do. So there is a chance where you are alone, so you're doing it alone. Remember why I said many people should be trained is because this is not an easy job. You need support. I really wish maximum people are trained. That's why I took this training to ensure, that all the people are trained, more the people are trained, especially in a war type zone or when there is some big calamity or situation, emergency situation, you need many hands. So this is the way. But if one is trained, they can guide the others also. But they should have the basic knowledge at least. And people tend to forget afterwards. So you need to have refresher courses. You have to check this again and again. I hope you will tell your family members to see so that they can help and you all 3-4 people in the family can help. So this is one person doing the CPR. If there are two, you can do like this, one is looking at the stronger one and the other can't do it, at least they will do the air part of it. So breath part of it. And then there is the third one where their third option where two people are both able to give CPR and they are both sitting next to each other, like opposite. And then while one person is doing, the other person is giving breath. Then when this person is over, this one will start. They are just next to each other. Then he will start. Then this one will give breath. Then he will start. So they take turns. This is the best way to do if there are two people. Any questions on this?
No, sir.
Okay. Now there you go. This looks very simple in photo. There are certain things you should keep in mind, really. What you should keep in mind when doing this CPR, where there is a chance you might break some ribs, or there is a chance that you are not successful. And most of the time not successful because it is not done properly. Here the catch comes. Here is the points that you need to focus on. So first thing, when you are pressing this hand, you must see that your force is at the center here. Can you see this part?
Yes.
So here it will be the maximum force. These are all supporting fingers, So this center part is the main force, pushing force. This force should come which part of your chest? Should it be this side? Should it be this side? Should it be up? Should it be down? Where it should be? Can you see
Center.
this? Can you see the nipple line? And can you see
Yes.
the center line? So where it should be? At the
Between two
intersection point.
nipples.
Clear? Now, why should it be at the intersection point? Why? Why not little here? Why not little there? You must keep this hand perfectly at this point. Why not this side? Why not this side? What will happen?
The chances of rib brokers.
Good. So whenever you move little focus weight out other side, they are just single grips, they might break. But this joint, with this center joint, along with the rib, it is a very strong position where all the bones are interconnected. So you must be very careful in this part. Now I was thinking a lot how to show it to you. Because this is not a practical, we are Zoom wise. So you should know this part that your forces should be, this palm should go to the center of this part, the chest interaction between the two nipples and the vertical line. Exactly. And then only, in this you might find this finger little outside. Don't go and look at this part. Consider this as a technical in this. You find it many times it is difficult to get the exact center. So keep this finger, this point, and this point exactly. Got it clear? Now, can you see why this is not the right way, this is not the right way, but this is the right way? What is the difference? First one, what is the problem?
The shoulders are bent.
The shoulders are okay, the hands are
The
bent.
arms are
Hands
bent.
are, I'm sorry.
So when the hands are bent, your force is, first going this way down and then pushing this way. So actually it is moving sideways and lot of your energy is not going in the right way. So don't do this way. Then what is wrong in this?
The arms are tilted.
These hands are actually at an angle.
Yeah.
When you are at an angle, from far away, you cannot get perfect pressure. You need really good pressure. Okay. So what you must do is, can you see this picture? Come as close and as hand should be straight. Okay. Can you see this?
Yes.
Right or not?
Yes, sir.
Right.
What is the advantage when you are right straight on the top and straight hand? This elbow is locked and you are using your body weight to push. Have you seen this?
Yes, sir.
Suppose you want to push a cupboard, okay? Is it easy to push by hand or with your feet and your shoulder it is easy to push?
With the feet and
Yes.
shoulder.
Yeah.
Good. With your feet and shoulder, if you push, it is more easier than just by hands. So yeah, this CPR is given by shoulder. Can you see this? Shoulder wise pushing it right down. So it is helpful. It should press a little bit. See, this hand has to press this in the center. See. So when it is being pressed up, down, this heart is started to pump. Can you understand this photo now?
Yes, sir.
Yes, sir.
So compression, normally people don't give breath, they only give compression. But if it is family member, you can give breath also. Okay. Now, nowadays you are getting even this way, pump, where you are pressing this and giving the breath, not giving by hand. Well, now how do we do that? Okay, we did that. Check the area is safe. D, then A. You check the airways, open them, then look at for responding. Check for the breathing. Look, within 10 seconds, 0.999, and then do chest compression. Now for the chest compression you are doing, you have to do certain number of check and then breath you have to do. Okay, and do it little fast way. Now what is the way? Who is not breathing? If he is breathing, no need CPR. Now, what you need to do is generally for average people working, this is for working staff. For house, it may be different. Just keep in mind. For working, it is cardio, means cardiopulmonary. CPR is cardiopulmonary resuscitation. CPR, there should be 30 compression, 2 breaths. This breath is for the lungs. 30 compression is for the heart. And then you do it at least for 5 times. But it can be even more than 5. It can be less than 5. It can be 1. Within the first cycle, 30 by 2, the person is normal, close. Don't worry. If the person is, next 2 or 3 or 4 cycle, 30 by 2, 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 mostly by 5 times, it comes okay. Okay? Mostly. It can take less, it can take more also. So, 1 cycle is 30 by 2. Can anybody tell what is 30?
The compression is 30
And 2 is?
to airway, to lungs.
Good,
The
the breath.
breath. Mm.
Now tell me one thing. This should be done in a rhythmic way, proper way. Okay? Now, if you want to see it in a rhythmic way, what you need to look at is that there should be at least 120 maximum. You can aim this, you can get 100, no problem. So, imagine you have to do 120 compression in 1 minute. What does this mean? If I say 120 compression in 1 minute, what it means?
We need 2 compressions in 1 second.
Very, very important, Samuel. Thank you. So just imagine the speed now. In 1 second, tuck, when the watch clicks one tick 1 second, you must have 2 compressions. So in 60 seconds only, then you can make 120. Now you should be very fast, properly rhythmic. You need support also for this. Okay, and you should do it right way also. You must have better to have somebody to do along with you. If it is 4, it is more better. 2 can change pairs. So you need this 60 in 60 seconds make 120. Then there is importance. You should go 2 inches or 5 to 6 centimeter. The compression should go in, means the depth. Just can't do little to go no. So you should go how much depth?
2 inches.
2 inches.
2 inches. And you should use 1 hand or 2 hand?
2 hand.
2 hand. Now this is for a normal adult, okay? 120 compression in 60 seconds. Do 30 compressions, 2 breaths. Compression should go 2 inches depth using 2 hands. Now, this is not the same with a normal smaller child or a baby. Why? Can you see this with a baby, with a normal child? Is it the same? How much chest compression?
15.
15.
50. In a grown up, it is 30, right?
Yes, sir.
So this is 15 chest compression and 2 breaths. So you must think about it, the speed and the breath, and you must use 2 hand or 1 hand.
1 hand.
Why you think 1 hand?
Because the depth of their heart to the chest is not far. So
Yeah,
when
even
we
the bones
apply
are
more compression, yeah, it may break
the
the
bones
bones.
are also not that strong. So it might break. So don't use 2 hands, use 1 hand. Don't do 30 compression, do 15 compressions, and don't go 2 inches deep. You have to go between 1 to 1.5 inch deep. But if there is a baby, an infant, will you follow the same thing? Is this chest the same? Or the young heart size is same?
No.
Again, the hearts are different. Like, baby heart will be smaller. Infant will be little bigger. The grown up will be more little bigger. And sometimes don't think about ages. I didn't put age here. You see the size of the baby. Elephant's baby is bigger than a grown up chicken. So there is a problem of not don't go by age. Look at the size. So for a baby, you need to put 1 hand or 2 hand?
No.
1 hand,
What you should
only
do?
finger, 2 fingers. Yeah.
2 fingers. Then do you need to go 2 inches or 1.5 inch?
Yeah, 1 inch,
Only half to 1 inch.
1.5, yeah, to 1 inch.
Maybe for a smaller, still smaller, make half inch. Little bit smaller, make 1 inch. So you have to decide this. Okay? This will be deciding on the baby, right? So this is thing. Is this clear with this part?
Sir, I
Yes,
have
sir.
one question.
Yeah, go ahead.
If there are 2 people doing the CPR to someone, so can we do the simultaneously like the 30 compression and 2 airways with the same time?
What do you mean by simultaneously?
Like same time, sorry. Same
No, but
time can we do?
your hand, either his hand will be in the heart, above the heart, or your hand will be above the heart. Can we
But we
both do
have
it
to
at the
break.
same place?
But we have to take break, like
Yeah, so do
with the
one
first
person
compression
finish,
and
one person do
yes.
30 by 2, then the second person starts 30 by 2. Then the first
Okay.
person starts, then the second person starts.
Okay.
Got it?
Yes.
So you should, there is only one patient, only one heart to be compressed. So you
Okay.
can't, 2 persons can't compress the same heart, same location. The other person has to remove the hand and then the second person has to come in. Clear?
Okay.
Are you satisfied?
Yes, sir.
Okay.
Hi,
Samuel?
hi, Rocky. Sorry, just before we move to the next slide, I'm just cautious of time. It's been nearly 2 hours of the meeting. I
Okay.
appreciate you probably have quite a few slides to go through.
Yeah.
It's just a heads up. Thank you.
Yeah. Okay. Thank you very much for that. So are you enjoying? Is it clear now?
Yes, sir.
Okay. So this was the thing about we cleared this thing. Then how long you have to do? Maybe 1, maybe 2, maybe 3, maybe 5. Depends if the person's is circulating is okay. Is or hand it over to the emergency, or you are tired, you can stop. Is anyway going to go then, or the physician declares him dead, or the scene becomes dangerous. So you need to stop. Which since we have little time, we can continue this with the next week. So then what I just cover one, we have other details later. I want you all to really learn. Recovery position is once you start breathing, the main purpose is to start the breathing, I told you. So you push the car, the breathing started, right? Or you did external help by the hand. The heart is not doing on its own. You are compressing, you are doing it, it started. Then you have to keep it in a position where, see, if you see there is a hand which is kept like that, second you keep the hand, this hand should be going here, then the legs and all, it's all okay. What is important is this hand should go like this. And the chin, remember the chin. In CPR, airways, the airways, we open the chin up. Like this, the chin should be open so that the person breathes comfortably. This is the main purpose of recovery position. If you see this hand, this is the thicker part and this is the thin part. This thicker part should lift the chin up. Making sense?
Yes.
Yes,
This
sir.
is the only thing about it. Don't get confused about it. Secondary survey is just to check if the person is breathing. No need CPR. Then you touch the body, check the blood, make the report. So choking we will cover some other time. If we have time, it's one small thing very good to talk. Choking is something stuck up in the mouth, and then there's something. The easiest way is you tell the person to do it himself by coughing. Even if you don't think that effect will come naturally. So a person will try to cough. Don't try to cough sitting. Try to be like a gravity, in a slope, go down. Even I will say little more downwards like that. So help gravity to go. So then second option, if after cough start hitting the back, so back blows. Then once you did these two, then you try two ways. Means the third way you can do is tell him to cough and back together. So this is like a two-way. He's coughing and you're backing. The two things can work more better. Then if this is not working, you go for pressing the stomach, the abdominal, by holding like this, hold like this, then hold the other hand and press it. When you press it, you are actually pressing the air and it will come out. But don't be standing. It is taking more time and tough to bring it out. So you have to bend into it out. And then this is another way to, when the person is not able to stand or something, you can do it with a different way. But though if for pregnant, except that the pressure is on the chest rather than the stomach, that you keep in mind. And for a baby, you slope it out. Like you put it on the lap, put the head downwards. This baby's head is down, this is down. But I made this extra to put yourself down. Keep your stomach and the head down. You can even, if you find a table, be on the table, bring your head down and cough and try. Somebody bang here also. So this can be also one way to do. Any questions? We discuss other thing if required. If it is required, we do it in the next continuation. So did you all learn something?
Yes, sir.
Yes, sir. We did.
Good. If you all want, we will see for the continuation. There's lots more other than choking. So we can cover those things. So I wish everybody learns, the society will learn. It will be a good thing for the humanity also. Okay?
Thank you, sir. Thank you so much.
My pleasure.
Thank you.
Thank you, Ranky, for the informative webinar.
Yeah.
Thank you everyone for joining us. This will be recorded also. And if you have any extra questions, please send it to branches@iirsm.org and we're happy to share it with Roku. And also there is a Qatar branch WhatsApp group that you can include any questions and start engaging any questions that you have. So yeah, just send it through to us and we're happy to support you. Thank you everyone for joining us
Yeah.
today.
Thank you.
Thank you
Thank
so
you so
much.
much.
Thank you
Bye-bye.
very much. Bye.
Bye.